All right, officially 1 week ago now, I received shoulder surgery on my left shoulder to get a labral tear repaired. First things first, I just want to give my regular viewers a quick update that I am doing okay. I'm definitely in better spirits now. In some pain, no doubt about that, but overall, I am doing much better than where I was a month ago. So, thank you for your continued support. Now, the real thing that I want to focus this video on is I kind of want to focus this video on describing what the surgery was like, what I went through, and how I would better prepare if I had to get this surgery again. So, for people that need to get some type of shoulder surgery, labral repair surgery, bicep repair, rotator cuff repair, any of those, or anything in the shoulder, this video is going to focus on some recommendations that I have for you in order to get yourself better prepared for this type of surgery. So, tip number one, I wish I had done this before the surgery. I wish I strengthened my core and my legs. Now that I have lost the function of my left arm, I'm heavily dependent on my legs and my core. Like the past week, I've been sleeping in an old crappy recliner because there's no way that I'd be able to lay down, and sleeping in a recliner is pretty much going to be a must, or at least having a like a medical grade wedge pillow on your bed. But I'm using my core and legs more than ever right now. Like I can't really lean forward too much to bend down and get things, so I have to squat down. Getting up off the couch, I have to use my core to like sit myself upright. So by having a strong core and strong leg muscles, it's really going to make it easier in terms of mobility after you have this surgery. Tip number two, if insurance will not cover a polar cube for your surgery, I'd highly recommend that you invest in a polar cube. That's what I have on right now in conjunction with an arm splint, but a polar cube it's kind of like a recirculating ice pack. So basically there's a little ice chest, and in that ice chest there's lines that you fill it up with ice and water, and then there's a water pump in there, and there is an output and inlet line that connects to the other side of this polar cube that's on my shoulder. So basically it's just recirculating ice water. There's like channels throughout this device. Condensation really doesn't collect on the outside. It works really well. But this has really helped to reduce inflammation and pain, because inflammation is kind of like the main cause of pain. So by reducing inflammation, it's really helped for me to manage my pain quite a bit better. Cost $150. Insurance companies, man, they're just cheap. I have quite a few choice words, but I'm trying to keep this video family appropriate. So there's that. That is tip number two. Tip number three, get your house ready. Do whatever you can to make sure that you're ready to go. Some things that I've done, like I'm not gonna really be able to do laundry for some time, so I like to have a really clean and organized room, labeled all my drawers. Get yourself a lot of easy to prepare food, like yogurts. Yogurts are good in the morning, just stuff that you can kind of do with one hand for lunch. I've been eating a lot of those Smucker's frozen peanut butter and jellies. It's important to keep your diet light, especially earlier on, right after surgery, because the medications really can block up your system. I was pretty blocked up. I had to take some laxatives, if I'm being quite honest, to get my system moving, and the cramps I experienced from the medications kind of like clogging up my system, it was rough. So I'd highly recommend that you have easy to prepare food. Try and keep it light for the first week, and keep your system flowing. Check with your doctor if you're allowed to take laxatives in conjunction with your medication, but if you are allowed to do so and the medication does allow for that, I'd recommend that after the first day and a half, if you don't have a bowel movement, take a light dose of laxative to keep your bowels moving. I know it's kind of gross, but it's just how it is. So there's that. And fourth recommendation I would have, besides making sure that you have some loose fitted clothing, I'd recommend that you have a caretaker. You are definitely going to need a caretaker by your side for the first at least 3 days. The first 3 days, especially the second and third day, for me were the toughest. You're going to need somebody to help you with everything, help you to get out of bed, help you to fill your ice machine, help to feed you, help to take you to the bathroom. Like, You're really going to need somebody by your side at all times just to help you through the most difficult part of this recovery process. From then on out, I'd recommend you have somebody that can check in with you maybe 3 times a day, because I'm still really unable to refill my polar cube, the little ice circulating cooler. So by having somebody that can come to the house 3 times a day, they just make sure that I'm okay with food. They help me do some light chores if I need, and they're able to refill my polar cube. So that is that. Those are kind of like the 4 main recommendations I'd have prior to getting this surgery to get yourself better prepared. So there's that. Now I'm going to talk about the surgery itself and kind of how it went for me. So when I first realized that I had a labral, of course I went to the orthopedic, it was kind of like a long process to really figure out what was 100% wrong with me. Like the doctor first kind of suspected, it may be a labral tear, but ultimately you'll need an MRI. So they did the x-ray, and then they put me in physical therapy. And then I did physical therapy for a month, checked back in with the doctor. Physical therapy's helping, but I'm still getting the pain. All right, finally went for the MRI. And then another month and a half of physical therapy. Of course, the next week the doctor confirmed that it was a labral tear. It's like, we're going to keep pushing physical therapy, and at the end of that, if that doesn't work, then we'll take more drastic measures. So 2.5 months of physical therapy, it did help to stabilize my shoulder, but I was still in quite a bit of pain doing normal tasks, and I got to tell you, it was really depressing. I've been really down about that, especially being 20 something years old. I'm in my late 20s and just experiencing shoulder problems this young. It's been really tough on me mentally, but I'm in a much better state right now. So physical therapy only helped so much. It did help, but pain was still there. So spoke with my orthopedic surgeon, and we made the decision that I should get surgery. So all right, so then surgery day came along. Of course, didn't have anything to eat 12 hours prior to surgery. I was scheduled for the second surgery of the day. Now, if you're really anxious about getting this surgery, or any surgery for that matter, like I am, I'd recommend that you try and schedule your surgery for the earliest appointment in the morning. I was told to be at the hospital, I think at 6 a.m. So, I was up at 5 a.m. that day. We got there 15 minutes early, checked in. And then once I got there, they put me into an outpatient kind of almost like a recovery room. You go in there, they put you in a hospital gown, then some lady comes in and she takes kind of like a sterile trimmer, shaves off all the hair in the area where you're going to get your surgery, coats you up with iodine, and puts a sterile dressing over you. And then you just wait. I was probably in there an hour and a half, 2 hours. And from there, somebody came in and wheeled me into the OR. And at that point, I was definitely freaking out a bit. I was bawling like a little baby going in the ER. I was just scared. It's a scary thing. Especially if you've never been through it. You're going to get cut up. You're going to be in some pain, and you're putting your life in the hands of strangers. But I had a really good staff, really supportive staff. So they wheeled me into the OR, kind of like prep room. And from there, I met with my anesthesiologist and my doctor. And this is something that I definitely want to talk about a little bit. So the thing that I was scared most about when it comes to this surgery was honestly the nerve block. So the nerve block, what is it? Well, you have all these nerves in your hand, right? There's kind of like a central nerve, from my understanding, somewhere like deep down in your neck. And what they recommend that you get a nerve block. Basically what they do, they sedate you and take a needle, and they use an ultrasound, and they guide that needle down to kind of like that main nerve area, and they inject numbing agent around that main nerve. And what that does, that creates a temporary numbing sensation of like your entire arm. There is some dangers associated with getting a nerve block. I was asking the anesthesiologist, what are the dangers? He said, well, there's a possibility of nerve damage. Chances of that happening are like 1 in 5,000, 1 in 2,500, something like that. But he said, you're a really good candidate because, you don't have much on your neck. It's going to be really easy for me to go in there and do this properly. So I agreed to the nerve block, and I just told him, look, I'm scared. sedate me as much as you can, please. I don't want to remember a thing. And he said, I'll do everything I can. So from there, I signed a bunch of consent forms just right there in the OR prep room. And then after that, the anesthesiologist came back. He started an IV on my opposite arm, started injecting me with a couple tubes of sedative, whatever the drug or medication was. So I got the sedative, and I remember asking him, like, hey, how long does it take for this sedative to set in? He said, oh, it should take about 15 seconds. And I remember talking to him for like a minute. It was probably like a minute and a half in, and he was starting to wheel over his cart, and I was like really freaking out at that point because I knew, like he's getting ready to numb me up and put this big needle in my neck. So I remember looking back and telling him, like, please, I don't want to see any needles. He said, no problem, I'll keep everything hidden. So, he was just keeping everything hidden behind kind of like a privacy curtain. And that's all I remember. That's all I remember. I don't remember anything about the nerve block. I don't remember feeling anything. I'm trying to find the right words here. I didn't experience any pain, really, throughout that entire process, with the exception of just getting the IV in my arm, which that's kind of like nothing. So anyway, next thing I remember, I woke up and I was in kind of like the recovery area of the OR, and I remember waking up and I actually felt just fine. It was the weirdest thing because I've been under anesthesia before, and I remember waking up and just feeling really sick. But you know what? I think the nerve block really helped because I didn't feel any sensation in my entire arm, part of my neck, part of my side. Like, it's a really weird feeling. It's like if your arm were to fall asleep, except multiply that by like 4 or 5. Just no feeling whatsoever. So yeah, I woke up with no nausea, and they had me in the OR recovery room for, I don't know, half hour, maybe an hour, and just talking with the nurse. Yeah, I'm fine. Just like, you want me to call anybody, any of your contact? I said, absolutely. Call everybody, let them know I'm doing okay. So in their half hour, and I get wheeled back into the initial room that I went into in the hospital, kind of like the prep and recovery room, kind of like the nurse's station room. So I get back there and, just talking with everybody that's there, and, like, wow, I actually feel okay. My throat doesn't feel sore. I'm not 100% sure if they intubated me. I was expecting my throat to be sore because I was really expecting them to intubate me. They may have, but I didn't have a sore throat whatsoever, so I'm kind of suspicious whether they intubated me or not. Regardless, whatever. So they gave me some crackers, some juice. I kept it down. I didn't feel sick at all. I didn't really feel nauseous. I did feel dizzy, but I didn't really feel any pain. So as for the surgery itself, like that day, I really didn't feel any pain, just a bit of dizziness and extreme stress and anxiety. So after being in the nurse's station, for probably another 45 minutes, wheelchaired out of there and on my way home. First night home, took some oxys and went right to bed. First night was okay. Now, I'm going to tell you the second and third night are probably going to be the toughest, because on the second night, the nerve block wears off differently for different people, but generally, like, over the course of one day, even shorter than that, maybe like 10, 15 hours, whatever it is, the nerve block wears off. And that's where you want to stay ahead of the pain. You want to make sure that you're taking your prescribed medications. But that's when the pain started to kick in. The pain for me, it really didn't go above a 6 or 7. Like, there were times where I really didn't feel any pain, especially when I just put fresh ice in the polar cube, when I had a lot of cold therapy going on the shoulder. The ice really kept the pain down, and then just staying ahead of it with the medication really helped. But there were definitely times where I got like spikes in pain, especially when I got up and my arm was hanging a little bit, or when I had to cough or sneeze or something like that. Like those quick movements and like when my muscles were tensing, that's when I was experiencing spikes in pain. But if you do everything that I specified, you're going to get through it. Second or third day is going to be the worst. Now, I was really clogged up as I mentioned earlier on in this video, if I could do it all over again, I'd check with the pharmacist and my doctor to ask if I could take a low-dose laxative, especially after not having anything, come out of me after the second and a half day. I know it's a gross topic, but it's important that I mention this, but just try and keep your system moving, because on, I think it was the third night, I was up the whole night with extremely bad cramps. Like I got maybe an hour of sleep that night. Eventually everything cleared out and things were fine. So yesterday I went back to the doctor and we did my follow-up post-surgery. They took the sutures out, put some steri strips over the incisions. It was kind of cool. He showed me pictures of the repair itself, kind of what he found prior to the repair and how he repaired it with the anchor. So it was kind of cool to see. And he also instructed me to start doing some light arm movements, like nothing extreme, but just, kind of like barn doors and just chicken wings, just like slowly starting to get my arm in motion. But I need to be really careful because I need to make sure that we give this plenty of time for the labrum to reaffix itself to the bone. So it's just a really slow process right now. A week later, pain is dull and achy. It's still kind of there. It kind of comes in spurts, if I could explain it. Sometimes it's fine. Sometimes it's really not there. But other times, it spikes to like 4 or 5, but, nowhere in the 6 or 7s like it was on day 2 and 3. So the pain is starting to subside, and doing these small motions that my doctor told me that I'm allowed to start doing. Of course, follow your doctor, but he said I can do this, I should do this 2 times for no more than 5 minutes a day. So it's a real small amount of time, but doing these motions has really helped to relieve some of the stress and tension in my arm for whatever reason. But it's tough. It's tough. It's slow going, and you just have to just consciously think about what's going on with your arm and just try to be really careful not to injure it and pull the repair out. It's just going to be a slow process. If I remember correctly, I think it's going to take like upwards of 6 weeks for the labrum to reattach itself to the bone, if I understand correctly. And then from there, it's just kind of like slow and steady professional physical therapy, rebuild the muscle, and just try and get back to normal function. Something else with this surgery, there is a pretty good chance that you're going to lose some range of motion with your arm. Like prior to this surgery, I had full range of motion. I could put my arm straight up. Of course, I'd be in pain in certain motions and certain amount of weights, but I had full range of motion. Now with this surgery, I'm expecting to lose maybe, I'm not 100% sure how much, maybe 75% of my upward range of motion, if that makes sense. So, before I could raise my arm to here, maybe I'm only able to raise my arm up to here, which I'm fine with that, but that's just something to be aware of. My doctor did say that over time, it likely will stretch out, depending how you use it, how much effort you put into proper rehabilitation. But he said it's definitely going to be tighter, because that's the whole purpose of this surgery, is to tighten up the joint. So that's pretty much everything I have so far. Next steps for me, I'm going to go back and see my doctor in a month, and we're going to reevaluate and see if it's time to start like professional physical therapy at that point. But for right now, it's just a matter of trying not to stay on the couch too long, trying to stay somewhat active, trying to eat healthy, trying to eat light, try not to put on weight, and just try and stay positive. Just going to be a long and slow recovery time. I'm hoping that I'll be back up in full function in a couple months. I'm expecting 6 months the worst. Hopefully it could be longer, could be shorter. We'll see. But that's just kind of what I've been through. That's what the surgery is like. And these are the tips I have for you if you need to go through a surgery like this in the future. Just be strong. You got to get through it. And ultimately, it's going to improve your quality of life. That's the whole purpose of this surgery. So that's it for today's video. Thanks for watching, and not sure what videos I'm going to post next. Probably reach into the old video archive, see if I could pull out some old never seen before snowplowing videos or something, because I'm not going to be able to post any physical videos for quite some time. So that's it for today's video. Thanks for watching, and I'll catch you on the next one.